All right, good evening. Welcome to the Town of Southbridge Board of Health meeting. Today is Thursday, August 8th, 2024. It is 6 p.m. in the Veterans Room. Relative to Mass General Law, Section 38, Mass General Law 38, Section 20F, and for the benefit of the public, this meeting is being recorded by both video and audio methods. Roll call, please.
Jasmine Canones.
Here.
Kevin Splain.
Present.
Roland Marichal.
Present.
Gil Provost.
Present.
Gus Steves. Present.
Okay, we have a quorum. Number 3, consider and accept minutes from July 11th, motion 2024.
Second.
Okay, I would like to entertain a motion to put this off till the next meeting so we have a chance to read them.
Motion.
Second.
Any discussion? All in favor? Unanimous. Okay, citizens forum. Any citizens that want to speak?
Yeah, Joseph, down 776 Worcester Street. You guys doing great job. Keep it up.
That's it?
Okay, thanks.
All right, we'll take it. Okay, anybody else in the audience that wants to speak? Seeing none, we'll move on. Presentations. Number 5, we have a presentation from the Southbridge Water Supply by Mr. Steve Gregoire of the proposed water tank on Commercial Drive and water line loop from Airport Road to Pleasant Street. Sir.
Evening, everybody. Let me slide up here with you folks, if you don't mind. Thank you for having me back. I spoke with the board about this back in February, just because I was concerned at the time with one, getting this project completed due to the issues up at the airport, and two, hoping to get the board's support, even though they don't have control over it, of any landfill royalty money that might help pay for this, or possible grants, which we could talk with the town about later. If you'd like to pass these around, if you wouldn't mind, send them this way. This is an excerpt from the hydraulic model that we have for the water department. And one of the proposed build-outs that we were supposed to build was a water line that ran up Commercial Drive and down Pleasant Street. And to date, the water lines were installed on Commercial Drive to get to Casella at the time, because that was the big push. They needed water.
Right.
And that's where the project died. There's a big pump station on Commercial Drive that's made to fill a water tank on Commercial Drive, and it's also made to go around this proposed loop, tie back down onto Pleasant Street, and connect all those homes. And it would change the pressure zone, because the people at top of Pleasant Street have bad pressure. This would help those folks as well. So I was going to create a pressure zone of its own up here, similar to the one we have on top of Denison Hill. And there was never any funding put aside or any capital planning for this. And again, because of the money that's available for the landfill royalty, I thought the board should at least hear about this. What I'm kind of proposing or asking for support for, because it's really kind of what the board can do with the council, is phase 1 of what you see on the map was actually installed by our in-house staff. We ran the water line from Commercial Drive to the airport. So that gives the hangar and the diner public drinking water. Well, now what we have is a big dead end. You've got a gigantic water line running with 2 little sources drawing off of it, and no flow, and it's a lot of stagnation.
Right.
Phase 2 on this plan, which is Airport Road, and phase 3 are what I'm asking for support for. Phase 4, which is the line you see going around the greater airport, was really intended to get put in if we ever expanded an industrial park that went all the way up there. And we're light years away from that. And also, there's a pink little square that says new 110-foot tall storage tank. That's the tank that would be required to make this thing work and make the pump station work right and everything else. So I had brought this to the board in February. They asked me to come back when I had more relevant information. I had Ty and Bond run us a probable cost study, and that was one of the things the board was asking for. This is an estimate for the linear feet of pipe we'd have to put in the ground, as well as curb stops to all the homes that could be connected. and once everybody gets a copy, they give us a probable cost with 3 options for a water storage tank. The option we need is actually the cheapest tank. So the total cost for this project would be about $4.2 million. I can tell you that construction costs are actually coming in under estimates right now. Not that we're gonna do the job right now. But just at a real high level, if everyone wanted to look at this, and even if you wanted to look at it until your next meeting, I just would like some support from the board to say to the town, we need to find a solution for this. Alternatively, there's actually one more thing I wanted to show the board, and I don't have copies of this because I just got it today. Every 3 years, the water department goes through what's called a sanitary survey with DEP. It's like a bad visit to the doctor you don't want to go to, because they go through us with a fine-tooth comb to make sure we are, as the military would say, dress right, dressed, perfect. And I'm glad to say they found no deficiencies in our system, which is fantastic. They sent us the preliminary findings today. One of the findings, because they did look at our maps and everything else, is Southbridge must evaluate an option for dealing with the deadhead water and oversized pumping station on Commercial Drive with a pressure loop connecting to other parts of town. So now it's on DEP's radar. We have 3 years to do this work. This isn't really anything official. I don't have the survey yet. This is just a findings they emailed me today. I thought it was relevant for tonight's conversation. But this tells us we have 3 years to get this done. So,
Done as in completed, installed, or done as in?
if we're making best efforts, because they realize this is our major capital investment.
Yeah.
But if in 3 years we've done nothing, this goes from a recommendation to a violation.
Right.
So this will have to, we'll let the board go first. Any questions, comments,
No.
thoughts?
And this is a lot to take in. I get it. I'll take any questions you have. This is a lot to chew on.
How many houses are affected by this?
I didn't count all the lots on Pleasant Street. I think, well, you can kind of see them outlined on the map.
Yeah.
1, 2, 3, 4, 5, 6, 7.
The
8,
last
9,
hydrant, the last water is at the old McKinstry farm, the White House before you start.
Yeah, Dave
the
Berger's
rise.
house.
Okay.
Right
Right.
where the, yeah.
That's where the last hydrant is, and it's always been terrible.
It looks like there's about 25
Seriously.
lots here. Real quick look, just trying to see these light lines that are indicated on the
Yeah,
map. Plus some houses on Clements Hill, which
All right.
they'd be even tougher to tie in because you'd have to run a line down that way.
Well, that was one question I had. It's 2 questions. That line that was run through the woods for the airport,
That's phase 1.
can that be tied, the way this shows you're connecting at the top of Barefoot? Is that line big enough to connect at the airport and then continue
That's an
around?
8-inch line, plenty big enough.
Okay, so you can connect there.
Yep.
So what you've already done saved X amount, so many
It's
hundred linear
1,300
feet.
feet of pipe that we put in the ground for the town for free, basically.
Okay, then that's gonna go around the southern tip of the airport to the intersection
Right, so phase 2.
where you are.
This
and
price
there's-
represents phase 2 and phase 3, and a tank.
Okay.
Just to put it in perspective, that's what that price is. Phase 2, phase 3, and a tank.
Okay.
Now, my other question, and I understand this because this place is unique from other dead-end lines because there's a pump. And when there's a use of water, it's directly related to the pressure gauge in the pump, and the pump stops.
Right. Right.
There's no baffle like you have in your basement for an expansion tank.
Right. And you can't compress a liquid.
Something's gonna let go. You can't compress a liquid.
Okay.
So there's problems with this in one way, and the other issue is by not having, because we've got a dead-end line, I think, Dudley River Road. I'm not sure if across from Cole Ave is still dead-end. Was that looped in?
No, it's looped in unless I'm forgetting something. It's tied in on both sides.
But we don't have many dead ends anymore.
Right. Except for your physical dead end little
Clements
streets and
Hill.
stuff. Yeah.
Yeah.
Going up to where Speak Vocal used to live.
Nope.
That's,
Nope. That goes back down. What's that road? It goes up Clements Hill
Oh,
and back down.
Back
Fifth Street.
down
Fifth
to River Street. Yeah. That area.
no, Cliff.
Cliff and Fisk goes up the hill. Yeah.
Here's my second question. Talking about what we were talking about before by looking at the test wells. If we found out, and that will go on the other avenue, that if we find out that the aquifer is moving because of the drop, A, we might get help, like we did before. If DEP wants to pay half, have a nice day, ends up our money somewhere
Tough.
anyway. If we find out that there's problems on Clements Hill, if it was teed off to feed Clements Hill, that's going to increase another problem unless we go all the way and tie into Cliff Street.
Yep.
Right. That makes
You could size it appropriately. They wouldn't receive fire protection flow, but you could downsize the main for the amount of lots that are over there. But you run the risk of if there's ever one of those fields is ever developed, you could be undersized. It's really tough.
And the thing is that I don't like, if we're going to dig and lay pipe,
I know.
do it once, be done with it.
Right.
And the problem we're finding now is, and this goes down a whole other rabbit hole, that as you increase pipe size and you don't turn over the water, you have an increase of all the byproducts that happen from high water age,
Yep.
which we fight every day now. The old days, it used to be bigger's better. Put a big pipe in the ground, you're good for 100 years.
Yep.
And now we're finding that with water age studies, it's a nightmare.
Yeah, right.
So you've got to be real careful with the sizes you put in that are sized appropriately for the volumes you're going to use.
And the other issue is that the system needs water flow in order to bring the treated water from point A to point B. And that's where I wanted to comment to things I saw on social media complaining about people filling the pool trucks. And I commend you on your forethought of one company in the top of Commercial Drive where the meter is locked, it's metered, so they're not getting it for free. You've got another company, I
Say that
believe,
again, so everybody hears it on social
you're not getting it for free. I believe you have another company that's on Dudley River Road in front of Regent's old construction company, because that's a dead end to help draw the treated water there with a meter, that's locked, and they're paying.
And we're making money on it.
They're paying for their use.
Yep.
So, because we have to, otherwise the water won't be treated and it will be stagnant.
Right.
And we'll flush it and dump it on the ground because we have to
Well,
have fresh water.
Used to flush it under the bridge on East Main Street, and that just fed the fish.
Yep.
So,
So again, I'm not really looking for any kind of ruling tonight. If everybody wants to digest on this or ask questions, you know, not that you can rule on anything anyway. I'm just asking for board support going
Right.
forward
Have
to
you proposed
encourage town council to find
Right.
a
Have
solution.
you talked to the manager about this and so forth?
Briefly a while ago.
Yeah.
As we all know, the manager has a lot on his plate.
Yeah, I know.
So I was waiting until we had some more data.
Okay.
And truthfully, this DEP thing is the biggest hammer that we're going to get hit with.
Oh, totally.
Up until now, we've been getting by.
I was curious about the location of this proposed new tower. Why is it there?
The hydraulic model picked that spot, not the model, the modeler. They look at different locations for elevation,
Uh,
and they try to find a spot that's got town land available,
Right.
which we already had a spot designated. When they built Commercial Drive, they actually stubbed the main for that tank.
That makes
So it's
sense.
prepped for it,
okay.
and they can get the elevations they need there without affecting any FAA regulations,
I was thinking that too.
which is,
Okay.
can be an issue. So I think there was one other site that might have actually been on airport property that was like a Site B, to
Okay.
not sound like a Jurassic Park episode, but yeah, there was 2 proposed sites. This was the preferred site, I
Okay.
believe.
That makes sense. Okay.
and the water line goes right by it
And it goes right
right
by.
now.
So the commercial drive would fill the tank and then gravity out to the neighborhood like it's supposed to, instead of a big pump smashing against a deadhead to feed the sink at the airport diner.
Right. That makes sense.
And that'll work the same way the Dennison Hill tank does, and every
Exactly.
fire hydrant that's got a black cap.
Yep, this would be another black cap zone, basically.
Yes.
If,
Yes.
if and when we do get this done.
Okay.
Well, this is only, doing this will only increase the value of the town with its infrastructure.
And truthfully, to get fire protection on Commercial Drive, if we ever have a build out, we've got to have this. If we ever do develop a commercial industrial park.
That's,
The other issue is too, it's gonna give you fire protection all the way up Pleasant Street.
yeah.
Yes.
Right now, the last hydrant's at the base of the hill.
Yep.
And because that's a dead end, I've been around using that hydrant, and it's not the best.
Not great.
One of the best, no?
Not the best at all.
Oh,
No, people on top of Pleasant Street. Actually, if we did this, we could actually change the pressure zone in the Cliff Clark area. We would change the valving way at the bottom of the hill and take those people off of the red zone and include them in the, they'd have tremendous, they'd have the best pressure of the entire loop now.
Right.
Instead of having the worst pressure in town their whole lives.
Oh, okay.
So there's all auxiliary benefits, ancillary benefits.
Steve, with this quote here of 4.2, is that just getting service right to a street clock in a property, or is that?
That's the way it reads to me as far as these probable cost estimates. I don't think this involves running the line into homes like we did in Charlton.
Right, that's,
Yeah, which, and truthfully, if we did it for Charlton residents, we should do it for Southbridge residents. But
That's true.
I do think that this estimate's high, but they really go conservative with these things. They don't want to lowball and then have us come back and say, it was 6 million.
Yeah.
Right.
Like for instance, East Main, we just opened the bids on East Main. That was estimated to be 3.6 million, came in at 2.6 million.
Nice.
Yeah, but we opened those bids this week, so I don't think it's awarded yet, but those were the bids. So these are conservative costs.
Right. And I remember when we did the Charlton project, it was much lower than we expected.
It was estimated to be a 10, it came in at 7.
Yeah.
Well, let me ask you, in case half the people view this, questions. If I'm not mistaken, when that water line went by Charlton, if our data of products and contamination does not show that it moves, I don't think we can force people to tie in. Charlton, they were forced to tie in because they had the data that the contamination was moving that way. If I'm not mistaken, because of that, when that line was put in, was it not also the copper lines that went to the homes?
It was,
It was.
And they waived the tie-in fee?
they did.
Yeah.
Okay.
did they use, I thought they used plastic.
No, it's all copper.
It's all
The only,
copper.
they did have a couple exceptions for plastic for driveways that were in excess of 250 feet long.
Right.
Because you'd have 5 couplings going up and it's a leaking, it could be a leak nightmare
Right.
down the road.
Right.
Right.
Copper, you can get, I mean, a plastic, you can get such long line that you'll have no seams going up. We don't,
And
our spec doesn't call for plastic, we made special exceptions.
Right.
And I know this is one of the towns that specs copper and nothing. You want water, you're gonna get copper.
Contamination can't get through copper.
Right.
That's why we do it.
That's one thing I've heard about as far as the plastic piping, is that that's a big issue up in Charlton with the MTB.
It gets through the, MET
yes.
permeates plastic, but
Yes.
things like dioxane does not, which is why we allowed it.
Do we know anything about whether PFAS is too?
That
I've
data
never
is
seen
not out,
anything.
that data's not out
No.
yet.
I don't know, I've never seen that, so.
We wouldn't have to worry about it because this will be all copper.
Well, that's.
It
that's
won't
true.
get through any
There's
of
so
this
short
stuff.
lines in town that'd be all copper.
Was the project that we did for Charlton also copper?
Yes.
Yes.
It was.
Like I said, except for
It
the
was.
1 or 2 exceptions that were extremely setback houses.
Is there any, would it make, is there any rationality to extending it to connect to that dead end and finish that loop there?
Oh, to run it around the airport and back up
Up
Help
toward
me
whatever street that is, yeah. That-
not Berry Corner, H-foot.
H-foot.
Yeah.
The-
There could be some viability to that. The previous director actually did have the line run all the way to the town line
Yeah,
in the event that we did that.
okay.
There was some pushback on that for political reasons, for who owns the water line, town, back and forth, but there would be some hydraulic advantages to doing that, yes.
And that would tie in all the way at the other end, so that would not be a dead end as well.
No, that was all the way around, yeah.
And that would be something for another day because that would be negotiations with Charlton
Yeah.
as well as this, we take care of Southbridge people,
Oh, totally.
period.
But there could be
Yeah.
advantages technically speaking.
Correct.
Correct.
Because I know, I was thinking about that because, obviously that, at the moment, there's nothing up there that we would serve. It's just a blank space at the moment. How much, did you spec out how much it would cost to do an extra line down Clements Hill?
No,
No.
not at this time. I think we can extrapolate the per foot price from this and do a reasonable estimate in-house because everything up top is related to the price of the line in the ground.
Right.
And the tanks are down below. So we could literally take the estimates above for square foot, linear footages and break it out. That wouldn't be a very hard calculation.
And then it would just be the laterals.
Right.
Let me ask you something else. If I remember discussion, time to take your meds. If I remember discussions way back, there was discussions about, oh my God, they're gonna tear up more streets. wasn't this line, with the exception of laterals, wasn't that at one time designed to go off the side of Pleasant Street?
It was designed to go off the side of Airport Road,
Okay,
but we never actually designed anything for Pleasant Street. It was
Okay.
just talk.
Okay.
There's no blueprints or designs for this loop laid out at all. That would still have to be done, which I think the engineering costs are built into this.
okay.
But yeah, there's zero blueprints or designs for the system, just the hydraulic model of what we should do.
Okay.
And for everybody that knows, this model, we have a model for the entire town. I just zoomed in on this one specific area. There's a really fancy schmancy hydraulic model that tells us everything about our water system. It's quite the piece. It's a binder like that.
I bet, yeah.
No, we have a very good workable manipulative system. Definitely. Okay, anything else for the board for this?
Thank you.
Yeah, no problem. Thank you for letting me talk.
How do we start this?
I think,
You know, like with the well testing and everything.
I think if we're wise, and I know you've done a lot of research on this with this stuff, if we can couple, because that's what happened in 16 and 17. We showed the flow going to Charlton, which initiated a spark that said we gotta do something. If we can show that the underground aquifer has changed, and potentially or possibly compromising, that may help us to sell it upstairs.
Between that and the,
I
between
mean,
that and our DEP order.
DEP,
Right. Well, the
And-
order itself is probably is very strong, because that'll
and as
stand
well
up whether or not-
as if
whether or
we
not
have
it's
to tap
supposed
into the royalty funds, there's a lot of people who are very resistant to it, but
That's what they're for.
and the other issue is if we show that it's leachate or whatever, we gotta be careful because the PFAS in the aviation fuel was ours.
Yeah.
But the landfill stuff, this could only be a tool to maybe
Right,
have
so the-
other
The
organizations
DEP
help
part says
fund
we
it.
have to do it.
Well, the
Then we
PFAS
have
can
to
be,
find out who's gonna pay
PFAS can
for
be
it.
from the landfills too, though. There's a lot of,
You
they're
are
finding that
right.
in
With the
the
2000, there was a 2023 DEP letter, Chair, that states Southbridge Recycling and Disposal Park Incorporated, SRDP is required to continue to implement and maintain the residential water supply monitoring. And as I talked before, DEP inquired with residents as to whether they would like to continue monitoring. And the residents that reached out that still want to continue are 184, 187 Berry Corner Road in Charlton.
Right, they've only reached out to Charlotte residents and given no concern for Southbridge residents.
No, I know. And I thought these two Berry Corner roads never tied in. I
There
thought,
are some select properties that opted not to tie in.
You know, weren't there something like 90 and like 87 of them? Or
Yeah,
86
nearly
of them
everybody
did?
tied in.
Yeah.
almost everybody tied in,
Yeah.
but there was regulations that people pushed back,
Yeah, I
that you
remember
could not use your well, one or the other.
I remember that, yeah.
So the testing is being done on those two properties? Have they had,
Well, the letter I did show you, Chair, it
Yeah.
did say 2022.
Right.
So assuming, and also, you know, PFAS will be incorporated in the testing after the DEP makes a final decision.
I don't know if they supplied you, the testing company supplied you with any, you know, like we get quarterly or whenever it is reports from the tests at the landfill?
These are the ones right there that I gave you for that quarter.
Right.
They're still mandated to conduct that. So the ongoing monitoring frequency, let's see here, my notes, as outlined in the residential well sampling plan for the landfill, is dated back September 2008.
Yeah, it's been around a long time.
Does that ring a bell?
Yeah.
And if I'm not mistaken, they're gonna continue this for 30 years, post-closure.
That's correct.
Does that say it specifically includes Southbridge houses?
Well,
Does it state houses, like addresses, or does
Well,
it just state whatever?
That's where
time
the
or-
clarification needs to be really
Yeah.
outlined.
Right,
Okay?
because I know that our town residents were getting tested too for quite a while, and then,
But I think it was all Ours was tested sporadically, and some
Yes.
did it on their own, and that was all that 2016, 2017 era.
Right.
About, let's see if we can figure out where this is going to cover
Right.
ourselves. And then they found that the majority of the flow was going north. And that's what prompted the work on, in Charlton.
Right, I know.
But everything here stopped.
And so my primary reason
For
for
now.
coming to the board, just as the advocate for the water system, personally as the water department manager, I was worried that some of the funds that are in the landfill royalty might get drawn off for things like a fire station, which I'm not saying isn't important, but in my mind, landfill money should stay around for landfill problems.
That makes
And if we
sense.
have contamination, it's a landfill problem.
That is true.
So I just wanted to be the voice to let you know we do have needs. Now, I understand you guys aren't the stewards of that money,
Right.
but you can recommend,
Right.
so.
But I think we have teeth. Because we control what goes on. We can control what goes on with the landfill.
Right.
But I agree, it's about the health and safety.
So that's all.
And it's capped.
Speaking of testing, I know you said you've had a concern with your own well. Have you heard concerns from other neighbors about the same issues?
There's been some turnover up there. I don't know if everybody really knows what's going on.
That is surprising.
Most of the tenants moved out up
There's
there,
a lot
most
of
the
turnover.
homeowners.
Yeah.
A lot of turnover.
So a lot of the folks that were here during the old Casella days are no longer residents.
And the other issue is, I know what you're saying, but my attitude is that we should be the stewards
I totally
for
agree.
these people.
No, I
to
totally
make
agree.
sure
I
that
want
there's
to
safety.
I would love to see them come forward so we can let them know what the history
Well,
is.
This will
And we
be,
know that they should be looking at this and say, hey, this is a concern. We don't know what's going on here yet. We know there was.
this
Other
is-
homeowners might not know either, though.
Exactly,
That's the
that's my
thing,
point.
so
I
how are we
agree,
gonna
I
get
agree.
them to come
this is
forward?
what we can talk about
Yeah.
with the director's report on
Yeah, I'm
C.
sorry. I kind of took us down a path, didn't I? I'm sorry.
Because
No, that's fine.
that
It's
talks
important.
about,
It's important. We need to
yeah.
It is important.
Maybe we should reach out to them and have them come to us or go visit them and talk to them and say, hey, what's
Let's
going on?
keep to the agenda. When we get to this agenda item, it might focus us on what avenue we want to start.
Right, that makes sense.
But as far as my presentation about the physical water system, if anybody has any more questions, I'm glad to answer them. You know you can all reach out to me.
Okay.
Yeah, we know where you live.
When do you have your dance time stay there?
Just look for the house with the lights on all day. Thanks.
Thanks, Steve.
All right, presentation's done. Okay. Number 6, review and discuss board membership in the Mass Association of Health Boards. Take any action. This should also note that I have a letter from August that not only the board, but all the office staff is included in this, they call it, let me get the verbiage right, senior moment, the regular membership. This covers all board members and all office staff.
Good.
Annually.
Good.
We are paid up to date. It's paid annually. The payment, the last payment to pay us for this year came out of the IMA grant.
Okay.
Since we don't have that anymore, we have to we're looking to see if we can pre-plan for the future because budget season is coming. It has not passed.
Right.
I have communication that went out to update the cost because it all goes towards the medium income and they have that kind of matrix. So I will find out exactly what the projection is for numbers on what it would cost.
Okay.
And there's a lot of advantages if one should, even if we needed a lawyer for some of this crap, we
Right.
can go to them. And we don't have to pay $400 an hour,
That
you
would be
know,
good.
on simple things. You know, especially if we had language or something on letters that would go out to these homeowners to see if they want to opt in to have wells tested and stuff.
Right.
So it's got good value.
That works?
Yeah, no, I've taken some, everybody, I would make sure that they have everybody's contact information, which you have to make sure that when you change it, you get that to us, so we
Yep, right
keep
here,
you
it's
in
a
the loop.
package.
And then they send out monthly emails, monthly updates and this type of stuff, and they also offer training. And I took a couple of trainings, it was right at 495 and 290 at a hotel out there, and it was, there's all kind of trainings, whether you want to get into Title V, whether you want to get into food, whether you want to get into anything. It was some good training by people, and the networking of sitting around the table with other board members was phenomenal. Plus, they fed you pretty good. So there's always a plus to keep you in the training thing. So there is a good asset to this.
Mr. Chair, Gus, is this the same one that we tried getting into? We
Yes.
postponed this, is that
Yes.
correct?
Yep.
Yes.
Okay, I just wanted to make sure
Yep.
that.
Yes, but I did check, and it's anybody who was in the IMA, it was automatic, the dues were taken out, so they were automatically in it.
Okay.
So we are in it. We are in it for the fiscal year.
Good.
So we don't have to worry about it till next year, and I'll get the numbers and then I can forward you what I get for what I
Actual cost.
guesstimate on the cost. So,
No action.
well, I don't want to leave it die. The director said he thinks it's a good idea. Do you want, make a motion that instead of doing this, that we show the board and the office has support of this? We'll have the record,
We can put it on record.
we'll have the records reflects that. How's
Yeah,
that?
that's fine.
I think that's an easy way to do it. We don't need a formal vote.
Yeah, that's fine.
Okay, perfect. Okay. Number 7, review, discuss Daniel Fuentes, did I say that right?
Mm-hmm.
As a representative, Region 2 PHEP Committee, and take any action.
Mr. Chair, I'd like to make a motion on this.
Motion by Mr. Splain,
Second.
second by Gus. Discussion.
Yes, I'd like to make a motion on this, that we switch Daniel Fuentes and have Roland Larichelle become the representative for Region 2.
So you are making an amendment.
Okay, I'd like to make an amendment. Sorry.
Do I have a second on the amendment?
I'll second that. I have to remember that. I mean, I know you know what you're talking about.
Any
Not that I'm
discussion
saying
on,
Daniel doesn't, but
any discussion on number 7 as amended?
any particular reason, Kevin, why you'd rather have him do it than Daniel? I certainly have no problem with Roland doing it.
So,
Just curious.
from my understanding, we're not getting any feedback on these meetings.
We're not. That's
None
one cat. I agree with that.
I think with
totally.
Roland's pretty up to date with everything.
Yes.
He attends a lot of these meetings, whether it's
He's got the
Through fire
yeah, he's got
stuff,
way too many of them.
through his hazmat. He's got knowledge.
Yeah. Oh, totally.
And
No question.
I think we'll get more feedback to the board.
That would make
And that's
sense.
why my recommendation was to do Roland,
That would make sense to me.
if he doesn't mind.
Get your finger on the pulse, so.
I got a who? Finger on Mike. Both sides.
Do you want to?
I have no problem. The quarter, from what I understand, the meetings are quarterly and they're on the computer right now. There's, like any other committee, I think they have other things that goes on. And then it's up to whatever the board and the office wants to look at too on these other things that come up,
Right.
whether they're interested or not. I mean, I appreciate your support.
It's triapic.
Good one type. Well, is what?
I said, is triapic still active?
I don't know how
I haven't
active
seen
they
anything
are.
from them.
I'm really not sure how active. I mean, the other thing with this, I mean, it's only like an hour and a half every quarter, and I don't know how much it took out of Dan's day. If he can, if this will allow him to excel on some of his other requirements. I don't know how busy his, or how projected the housing and everything is projected to be busy.
He's able to fit it in, I can tell you. What it is he's been showing a lot of interest in this. He has some background with this type of processes and information. So, but we, from my standpoint, we want him to evolve and grow.
Yeah.
And position ourselves intrinsically into the department, that we have someone there all the time that knows about this. And at this point, he's done a really good job. Securing, connections and maintaining them. And we just want to build on this,
Yeah,
build the program. So fundamentally, it would be wise to have him still continue in conjunction with Roland.
I like that, yeah.
In what the board sees in what capacity. Again, he enjoys those trainings as much as the meetings monthly that come up, as I did before. I passed the torch to him. They're beneficial, this cause. So I just want to express that.
Well, let me say this, from what I understand, and I could be wrong. This does not preclude him by any way from attending if this vote is through.
It does that.
This only allows, there's got to be one, if I'm not mistaken, like any other organization, there has to be one representative, voting representative for that organization.
Right,
Voting, yes.
right, that makes sense.
And this board, through the many years that I've been on and off, Nicole's been here, the board and the office has worked hand in hand very cohesively. And I think if this goes through, me being semi-retired, having, if I'm voted to that, that's what doesn't that does not restrict or preclude Dan from
It does not.
attending.
It does not.
And it's called working together.
Yeah, I agree.
It-
So
it-
I would not have a problem of the association having my name as the representative for this Southbridge Board of Health, which is all inclusive of everybody.
Right.
And like I think I've shown here, even though the law might allow the chair to make decisions, I will not, and I refuse to make decisions without getting the input from the board. The board says no,
Yes, you-
they put me in this position, they can take me out of the position.
So please, Jared, just recognize that the monthly meetings are obviously required in order to vote.
Correct.
Because all of the materials
honest with
are
you-
identified, so.
The email started popping up on my email, which I had no idea why. Okay?
Yes.
So I think they're already scheduled through September.
Many of the meetings are,
They're on
online.
Teams
Yeah.
on the
yeah,
computer.
yeah.
For now, you get better results. Anything else? Okay, then we'll, you made an amendment. We voted, we got a,
I got a motion and a second. No
you got a
vote.
motion and a second. Vote on the amendment, to amend number 7.
Yes.
All in favor? Okay, so, number 7 is amended, review, discuss, Roland LaRochelle as a representative to the Region 2 PHEP committee and take PHP committee.
Thank you.
Motion as amended.
Motion.
Second.
It's already been made and seconded.
You already did.
We
And
did the
voted.
amendment.
We just voted the amendment,
We just
that changed the motion. The motion, we are now voting on the
That's what I
amended
read, the motion as amended.
Yes.
So now we have to vote on the motion
motion,
as
correct.
amended. That's what I read.
Yes.
So we got a motion as amended,
Yeah.
and you said second?
Mhm.
You had a question, sir?
If you don't mind. Thank you, Chair, for you. Hey, that position is allow the board members, not the employee at the Board of Health, to take that position? Isn't it?
The Board of Health,
Yeah,
doesn't.
but you know, you guys appointed, not full-time.
That's okay.
Is that allowed? Just question. You don't need any specific certificate?
No, this is just.
No, the only thing that you need is you need the registered, you need the legal membership of the board.
Yeah.
You have to be, it's like the MAHB thing, that there is membership for people who are not board members
Right.
for more money. This is for board members. Technically, the board is supposed to appoint their representative. So it's board or staff,
Right.
either way.
Right.
Got a motion and second. Any other comments? Seeing none? All in favor as amended? Opposed? Unanimous. Thank you. Okay, now, thank you, I think. Now we have the health director's report. A, we have the update on the listeria issue of deli meats and boar's head meat recall and take any action.
Okay, thank you, Chair. So the recall was due to adulterated/contaminated sliced meats with the pathogenic bacterium listeria. Very serious. The U.S. Department of Ag and Food Safety and Inspection Services, FSIS, initiated this. 71 products under Boar's Head and Old Country brand names, over 7 million pounds of ready-to-eat meat, poultry products intended for slicing at retail, and some packaged meat and poultry products were voluntarily recalled. This was a Category 1 type recall where the probable health hazard will cause problems and/or death. So it's yeah. And unfortunately, 43 people are sick, and just in 13 states with 3 deaths now.
Right. I don't think there was any in Mass.
There was not. There was product here
Correct.
that had to be recalled, but no illnesses have been reported to the health department, and none in Mass that we know as of yet. So FSIS is working with CDC to investigate the multi-state outbreak and infections linked to the deli meats. We as the health department did go out in the field to ensure that locations, permit holders, retail food operations and establishments were not having any of these products. And as I showed with you, we used this process, which was most helpful when discussing this with the people in charge of the facilities to ensure that these products have been put in. Fortunately, with this recall, so it was so widespread that the distributors' word got out very quickly, and it still does. And so we did not find any type of boar's head products. Either sliced meats that were going to be sliced or the grab-and-go type ones that are already pre-sliced. So they were off the shelves, thank goodness.
I mean, I
We still monitor the situation.
I mean, I know I did see a few of them over at Big Bunny, but they had a sign saying that they weren't using any of the products that had a problem.
Right. And these were, specific ones.
Exactly.
As you can see, there's a lot of different products that boar's head calls. But these were instrumental in identifying this and ensuring that there was compliance with the recall processes. Okay? So,
Did those agencies reach out to, I know Big Y totally dismantled their deli, cleaned it. They took all the boar's head, they stored it in the back
Yeah.
because there's lot numbers that reflected the contaminated food.
that's right.
And they told me that none of their lots,
Right.
so you could go back to work.
When it gets back, when it's a Category 1 type like this, information is sent from all the different avenues, mainly from the distributors, stop, and you have quality assurance teams such as Big Y that get the information very quickly and disseminate that information and clarify it to the stores all at once.
Did they-
So action is taken immediately.
Did they trickle down, all the way down to, let's say, your pizza parlors
That's
that
what I
use
was
sliced meat?
Well,
Do we know?
yes, it does,
Okay.
but it goes to the retailers. The larger ones. We'll use Big Y as an example. Costco's, Walmart. But then the distributors, U.S. Foods, for example, will also get this information. They're required to go through the list of where they may have brought this product had they had it.
Okay, good.
And it's a system in place that's done electronically,
Mm-hmm.
and it's fairly accurate. It's, again, what a challenge may be, it's usually quick, but sometimes there is a lag time, obviously. So we try to get the information pulled out, but usually accomplished in a day.
There's just so many streams of ordering
Exactly.
food now.
Yeah.
And I mean, I'm thinking about my programs and, like Instacarts now and,
Right.
like so
Well,
that's
and
kinda like
then you have to
just
look,
so-
yeah,
Yeah.
The
you're
pizza
right.
shops.
But
you
it's
know,
still,
have- or have-
Instacart's gonna go out and they're
Right.
getting stuff from a distributor, and the
Right.
distributor
And
has
distributors,
been
and
on top of
that's
it.
the distributors, that's the second line, but Boar's Head, since they are licensed under the USDA, have to have a comprehensive recall process and a program. And the network, I mean, they're a pretty big company.
Yeah.
As you can see, 13 states and elsewhere. So, I mean, it's a lot of work, but right now with the use of technology, it can be dispersed a lot quicker than the old days, obviously. So it works pretty well. It has to be tested for them to be in compliance with regulations. I think it was effective right here. Unfortunately, the outbreak, took 3 lives and 43 people, and that could be still counting. Because there's an incubation time with listeria, and we just don't know.
Is there any risk that somebody could have bought the stuff, thrown it in a freezer, and get infected, say, 6 months from now?
That was.
I don't know.
It's
if
three
the
days to
freezing-
3 weeks, the incubation, the onset of symptoms.
No,
So
but maybe it was frozen, and then they thawed and eat it.
Yeah, right.
Oh, yes, well,
I don't know if-
listeria, it's a psychotropic type of bacteria, so it can stand cold,
Gesundheit.
cold temperatures. No, below freezing, when you have freezing of any organism, it's just gonna put it in suspended battery.
I know, so.
Right? So, in theory, yeah, when defrosted, if the product's contaminated. Fortunately, with this, you go from CNN to Fox News to any kind of, this has been, I mean, identified on the internet, any kind of browser you're using, I've seen it all day long in updates.
Well, what I'm thinking is somebody may have bought it, let's say a month ago, and they didn't bother checking the numbers and all that stuff. They threw it in the freezer for future reference, and then say around Christmas they make Christmas dinner with the stuff.
No, everybody's dead.
You know, that.
Merry Christmas.
Hopefully, with the information
staying
that has
home for
been
Christmas.
sent out, people
Eat
heed
vegetables.
the warning. Yeah.
You know what, anything like that is possible,
Yeah,
and that's one of the biggest challenges when you got biologicals.
exactly.
You got the incubation time, freezing does not kill them.
Right.
It only puts them to sleep for a while.
Right.
So these could reemerge if somebody did that, and that's one of the things that the Maven system and the other systems,
Sure.
Right.
and you have to play catch up with biologicals because it's after the fact.
That's
So everyone that is using Maven now, is still on alert, looking for these
So I don't
signs,
eat meat.
symptoms.
See?
They've had recall in vegetables too.
Well,
Yes, yes. The biggest one with listeria was years and years ago with cantaloupes.
Yep.
Gross, that's why you shouldn't eat
That's
that
what
anyway.
started on, yeah. That was huge.
But you're not
Farm
eating
in
it anymore.
California, Colorado. So fortunately, in the health department world, we've learned a lot about these organisms, their proliferation, and how to stop it
Good.
as much as we can, or mitigate it. So that's my update. I'll keep you, the board posted if
Perfect.
need be.
Okay, thanks.
Okay, B, update on COVID and any other infectious contagious disease counts and tracing,
just put a plug in.
and take any action.
Huh?
Roland, she's got a hand up. If you don't mind.
Oh,
After this discussion, I encourage people not to eat meat and to eat as local as you can.
yeah, my farmer's market, so Wednesday.
It's always good to eat local,
Right, try to eat local.
So she wants to put the local beef farmers out of business.
Okay.
All right.
Moving on.
Moving on to B.
Let's see, I did forward everyone the recent counts from our public health nurse. hopefully we've all looked at it. You can see coronavirus, COVID-19 is still among us. Yes, it's endemic, but the focus now is on clusters and outbreaks. You know, what I've learned through that and the numbers, they're not that. There's less severe symptoms, fortunately, and reduced hospital visits. So community mitigation strategies continue with vaccine doses. COVID-19 isolation and exposure guidance for the general public still in effect. Again, it's guidance. CDC announced the 2024 to 2025 vaccines are expected to be available in the fall of 2024. Recommended doses vary by age and immune status. And obviously the concern is with moderate to severely immunocompromised / suppressed individuals. That's what COVID. As you can look at some of these cases, one that does really stick out to me is the dengue fever.
Yep.
It's associated with traveling. There's millions of cases of dengue fever. Where this individual traveled, that's all confidential information, but the case report is available. But that's something that I can't discuss in public. That was an interesting one. Again, it's mosquito-borne.
Yeah.
It's an arbovirus.
Can I clarify one question?
Sure.
Did this person come here with it, or did they catch it here?
Travel.
They came back with it. Because I know that we've never seen cases this far north, but there are some creeping into
There's
like
our
Florida and
exceptions,
southern
you know,
parts of the
people
US,
travel.
so- And the CDC found 50 cases of dengue in Massachusetts this year.
Now, was that, and that's the other difference with numbers that concerns me. Like it said, dengue suspected.
Yes.
What is the definition in Maven of suspect? Does
They-
that mean that the person showed and exhibited signs and symptoms? Or they were in a country or area that had it?
They have to exhibit signs or symptoms of a recognized disease.
Okay,
And they're having, suspect also is a condition or the illness in which these signs are present
Yeah.
and the symptoms. That's what suspect is.
okay. So that's the difference between probable and suspect.
That's
So what's the difference between suspect and confirmed? They haven't been tested if they're suspect.
Well, confirmed has had a positive test.
They were tested. That's okay.
For like COVID, it's a molecular test,
That's okay.
right? So just think of that. Testing has been done at that level. And it's even, you know, it's higher when you do a molecular test than a probable state when you just do a home test.
Right.
Okay? Laboratory driven, conclusive. That's a confirmed case. As you can see here,
Right.
you'll have that with confirmed probable coronavirus. But this is something we do receive monthly, and I can ensure the board members that if something spurs the public health nurse, and she is very concerned, whether it is a cluster, whether it's an isolated type of pathogen like that, she will call to discuss.
Right.
And out of this one, there was no high level of concern.
That's good to know.
Not to say that there's not going to be continued monitoring, even with the dengue, you know, because you're right. There was an incidence of the fever
Is dengue
in Massachusetts.
Can dengue be passed from person to person?
No.
No. Okay. But can somebody who has it here pass it to the mosquitoes that are here?
That's a good question. I think the research
I think it's from the vector.
Vector,
It's
yeah.
the vector,
Not
it's the vector.
person to vector,
Person.
it's from the
Yeah,
vector to a person.
Yeah, it's usually from.
I don't think it goes backwards.
You have to have
I don't know what that's
that. Which, you know, the reservoir
Yeah.
is the mosquito.
Yeah, I know.
And the vector, the vehicle of
because the way
contamination,
the-
or infection, they call it.
Yeah.
And it's that,
Because I know in some diseases you can go back and forth.
Yeah, I don't think this one, because of the way
Yeah.
it's procreated,
Yeah.
that the actual is created, yeah.
and more research now is focused on the vaccines,
Yeah.
which is good.
Yeah, people get them.
Because again, it's fairly endemic, Latin America,
Yeah.
Africa,
Yeah.
you know, and it does spread. And we've had it in the southern parts of the US,
Puerto
parts of
Rico
Europe.
has it, gets
Puerto
it a
Rico,
lot.
that's right,
Yeah,
that's
yeah,
right,
yeah.
that's right.
It's huge out there. A lot of standstill water, a lot of like polluted
Yeah,
water.
everything
yeah,
conducive for
yeah,
mosquitoes, sure.
yeah.
Okay.
Perfect breeding grounds.
The one that scares me, or concerns me, two things. The Lyme disease,
Yeah, I saw.
at 5 right now.
Can't believe
I
that.
expect that's a lot lower.
And the problem, not so much the number 5, is how often healthcare misdiagnoses it.
Oh,
Yeah.
yeah, oh, yeah.
Sure.
Oh, sure,
Yeah.
good point.
That's one
Absolutely.
thing. The other thing that I want to make the board and the public, we did a lot of work through COVID. We did a lot of tracing through COVID. She gave us for the last month, June and July, 32 confirmed cases of coronavirus. Now, there's one thing I want to make note. During COVID, it was very easy to trace because you were tested. There was no such thing as a home test.
Sure.
So you went to a testing place, medical testing place, the hospital, your PCP. They are reporters. They had to put it in Maven. All these people that turn around and have a home test that comes out positive and they call up their boss and they say, I can't go into work today, falls under the radar. Nobody knows about it. So my other question, because she does the reach back to these people, 32 people, were there any of them, because I'm trying to think in the past when we had COVID, did any of them involve the school system?
She did not.
Contact with the school system. We had one, and the reason I'm saying we had one during COVID, that it was a worker this time of year, working in the school that was doing and preparing the school lunches for them to pick up.
Yeah.
That evolved.
Oh,
That contact and the information had to go on.
Dan, remember we were getting that grid, like that broke everything down
Yeah, yeah.
before? That had the schools on it.
Yeah, it did. Again, that was 2023.
Yeah.
And again, just to reiterate, where we're going here is there's a cluster, an outbreak
Right.
associated with the school. A public health nurse will be highly concerned and reach out to the school nurse
You okay?
in order to enact any measures that they feel necessary.
Yeah.
But just to reiterate that right now with the virus, the clusters and the outbreaks,
Yeah.
wherever they may be,
Right.
school, in any other kind of
They
setting.
coming.
Whether,
large enough
yeah, be a private setting of, a business. Can they still happen, and have they? Absolutely.
God, yes.
Yeah. And they're gonna go
Unfortunately.
up from here.
Right.
I mean, that's my concern. If we had any, to prevent the clusters. Reason I'm saying that, in the past, we had a elder daycare, if you will, and we had a client that tested positive. It was reached back, found out when you tested, when's the last time you were on the bus, when's the last time you went there, so that the department helped out that group and made the contacts on reach out to your people, because the other thing you had to be careful of is HIPAA.
Yeah.
Yeah, so.
You have to be
tracing-
careful with that.
Yeah.
But you had a person on your bus at this date,
Yeah,
notify everybody, clean that bus,
yeah,
watch and do that outreach.
yeah.
We had one there, we had one at the food thing at the school, we had one at a 6 or 8 family that kept going floor by floor by floor. And we ended up reaching out to the landlord to say, listen, We gotta get that education up. And we ended up having a favorable result as that came. You know, when you're told to stay in your house,
No, yeah.
don't go hang around in the hallway. But that was a concern with that, and I'm glad to see it's, you know, some of these things, Lyme disease, yeah, everybody's outside. I'm worried about the diseases coming this fall because we didn't have a good hard freeze last year, like triple E and everything, and so far that's all staying away.
Staying away. Not
So
bad.
far.
I haven't seen that many ticks this year. I remember after a couple of meetings ago, I commented on seeing a whole bunch of them quickly, but I haven't seen that many. I'm out indoors all the time. Except for that, like 1 week, I haven't seen that many.
Yeah,
Well,
and this is the time of
hopefully-
year, you can
But
see
not
with
a lot.
the salmonella,
Yeah,
campylobacter, this is indicative that it's summer. You see more incidents of the enteric bacteria,
Yeah, right.
foodborne stuff,
Good.
you know? Which unfortunately, there's 2 cases. I've seen more.
Yeah.
Yeah,
yeah,
Okay.
perfect.
Thank you.
Keep us updated,
Will
please.
do.
Thank you. Nothing else on B? We good?
Yeah.
Okay. C, update lane for monitoring well tests regarding private well testing is requested on July 11, 2024. Citizens formed by Mr. Gregoire, 555 Pleasant Street. Take any appropriate action.
Okay, thank you, Chair. As I showed you all this, this map, in which I took the results and I did the analytics from the latest report, which was the first quarter of 2024. And to make it easier, extracted and compiled that information from a report that's literally 4,700 pages long. But it is sectioned where we focus on the monitoring well test, the groundwater. Okay. The contaminants that were found in levels that exceeded the maximum contaminant level, MCL, the secondary maximum contaminant level, arsenic, 1,4-dioxane, lead, manganese, and iron.
not the arsenic.
Most noteworthy is the location. As you can see, it's on this face, southwest.
Right.
There is predominantly more wells here. They're scattered. So on this map, I have put in by color where the contaminants exceeded the levels through their testing.
Did we have?
Some patterns there. You can see
Yeah,
clearly.
and that's,
For sure.
that's what I was going with here. Did you get one?
I did not.
I don't know if we got this draft. No, we'll make some. That's what I was getting at and I was trying to research the 2016, 2017 results.
Thank you, Jen. I'll take the big one. Yeah.
Daniel, is this pen right here? Oh, okay.
And you can see some of here are coupled, so when I put just the colorations in, it's from one test well. Right? It's monitored.
Yeah.
So they
1,4-dioxane.
they run the analysis, they can get arsenic thick and get that 1,4.
And that's what I was looking at. As a tool to work with his presentation earlier. That if we can show, and I've got some stuff from 2016. I'm trying to find if they did the 1,4-dioxane. Yeah. So they were testing it, and this was at 535 Pleasant. So that would have been just down from him but on
Here.
the airport side of Pleasant Street. No, that's his side. So with what you're showing here is what we were talking about. 2016, 2017, all these pretty colors would have been over here.
Right.
That's why,
Because most of the general public doesn't understand that the underground water table does not flow by gravity, it flows by suction. When somebody uses it, draws from their well.
So it'd be like down here, you're saying?
Steve lives right here.
Right, yep.
So 2016, 2017, these test wells were showing all these products
Yep.
in the north side, for lack of a better term, of the landfill.
Right.
And that's what put the focus towards the people in Charlton. Now that those 80-plus wells that suck from the aquifer are now dead-ended, that leaves, and the question is it going somewhere else?
Right.
So we have wells from here,
Yep.
all the way down to here, both sides of the street, and Clements Hill.
Yep.
So the question is, has the aquifer and the underground flow changed? And the way this looks, thank you for your coloring, because that, on trifocals, that helps. It shows that we've got more contaminants going west.
Yep.
correct.
Yep. Southwest, yeah.
And this information, hopefully saddled with his presentation, may offer this community assistance with not only what he brought to the table of DEP has the radar on it,
Right.
but we've also got facts from these test wells
Yeah.
that it's a good shot
That's the data.
that it's going to be moving westerly.
Yeah.
And we have to take care of our own people.
Absolutely.
Yeah.
And if we show that that's moving, we could get assistance because money is the root of all evil,
Yeah.
and that stops all projects.
Sure.
So we have the royalty fund, but if we can spend, I don't want to put people's health second, but it's the real world.
Yeah.
If we can get help to get this project done, we'll be able to get this project funneled through the red tape faster, and we'll get it done faster, with less impact to the community.
I think. What, we're,
Oh,
yeah.
I totally- I totally agree.
Yeah.
Complete sentences.
All right, you said
Yeah,
it.
what she said.
Yeah, the sign, whatever, yes.
What'd you say, Steve?
So if I could, if the other committee members have commented or are all set for now. Just having been involved with the Charlton Water Project, I can tell you by looking at this very same map 10 years ago, the north side or the Charlton side of the landfill, that's where all these colors were plotted out before.
Yeah.
Right.
And now you can see those wells aren't even showing as MCLs anymore. So I think it is pretty clear the contaminant flow of the aquifer has shifted.
Shit's running down now.
So, you know, that being the case, you know, I don't even think a round of testing is warranted here. I think a testing program is warranted here on private wells. If not, moving forward with the water line, which ends all of this discussion, because now you've mitigated the problem.
Sure.
And I think my opinion, or my thoughts, and please everybody else chime in, approaching the manager or whatever avenue this would take, subcommittee, I don't know how you would want to say it. The letters went out to Charlton on all the people if you wanted to be part of your well test.
Yep.
That was the first step to give it them. That gave you tangible numbers of how many tests you would do. Steve, at the last meeting, you talked about a radius around the landfill. I think now we have to go towards more of a plume, the way this data does. I'm not saying eliminate Clements Hill, but if you're gonna go a certain radius, I think we have to more focus on the Pleasant Street plume and don't go as far down and see what we get on the first section of offers of testing. Of course, if we get positive tests or concerning tests on Clements Hill, we move further, because that was your second proposal on the project on running that line down there.
Well,
we gotta determine how far we're gonna test. Are we gonna test for VOC, we're gonna test for PFAS, because that was not done on the Charlton side.
It never was.
No, it
They
never
didn't even
was.
consider
My
PFAS.
question is
Exactly.
this.
So we gotta take that into consideration at the same time as well, because you're going from $800 test per house to a $3,500 test per house as soon as you add those two in.
All right, never mind
Here's-
later treatment
Yeah,
costs. Yeah.
Here's a question, and Steve, you involved in it in Charlton. I don't know, like you said, back then PFAS wasn't part of it.
No.
PFAS is a big thing today,
Yes.
okay? I don't know if PFAS would be automatic. The bottom line is, the testing was done in Charlton. It was VOCs and dioxide?
They only tested for dioxide.
Okay.
That was it.
They tested for that, and look at the results.
Right.
They got a water line.
Right.
My curious thing today is that wouldn't we push forward testing for that and PFAS? And start there?
I think due to the issues with the well-documented issues with the old fuel tank at the airport, I think you have to include VOCs.
Okay.
Because you have gas leaking in the ground. There's a reason why the airport well is unusable.
Right.
We had to
Okay.
run a water line to the airport, and that was as far as it went.
I'm just talking because I want to get answers, because if you're going to push for more tests, somebody's going to question why.
Right.
And you want to have the answers out there before the question's asked.
Right.
And then I can tell you from the experience at Charlton, when it did come down to getting Casella on the hook for this, the health agent in Charlton, your counterpart, Jim Philbrook, as well as the Charlton Town manager, were the driving factors in getting DEP involved, getting the waste site contamination group involved, and then with DEP helping with the project. So they were instrumental in really pressing that issue, once there was some testing to back it up.
And I think if we start with a similar process, because we can't go into people's houses without being invited.
Of course.
Send out the letters, let's test for the 3 products. Start with that invitation. It's gonna be for upstairs and where we're gonna pay for it. But the proposal about the issue with the water system and the damage that can go by dead ends and the DEP thing, and now, which is more important, the flow of nasty products being redirected towards another section of our own town.
Right.
That is the primary concern. I think we should push this.
It's very compelling.
Yeah, I think we should push this ASAP to start this process
Mr.
going.
Chair, can we starting tonight, can we get the ball rolling tonight? We're gonna take a vote, make a motion where we talk to the TM and have it go to PPP, General Gov.
Well, let me ask you this. Would you be, how do I want, we gotta word this right. We make a motion to start the process of having private well testing. I've got some old stuff, you've got some new stuff about the letters to go out, stuff like this. If we work together to put a package together
To do that.
on how we're gonna start this, and even if Jack wants us to get together and give a proposal to whatever subcommittee he wishes,
It would necessarily, yeah, warrant a proposal. I mean,
Definitely. we gotta sell it.
Well, do we?
I agree, we
can-
gotta
can-
take care of our own now.
Can the,
Take
can the
care of
board,
our own.
can the health department and the board of health, do we have enough extra funds to start to send out the letters and start the process while we go to council for more funds?
Here's my
I
question.
wanna step on toes.
Because we certainly have the legal authority to do it.
Right.
Yeah, we can,
And we should do
it.
we can do that, and I'm not talking about dragging our feet. We
No,
can
I
start with
agree.
something
No,
right
I
now in
totally
these
agree.
letters, because if this board votes to prioritize this and look into getting private wells tested,
Right.
and leave it a little bit open-ended instead of diameters, let's add Pleasant Street, Clements Hill, west and south of the landfill. Because of the curious flow data.
Right.
Um,
Do we have
start
concentration data
there.
for these? Do we know what the concentrations were for these things?
Well, they just exceed the limits.
Yeah, we'd have to look up the
Yeah.
MCLs, then
Yeah.
know how far up over it is.
I do have that in there. It's
And
just
if I
about the-
remember, a lot of it in Charlton didn't exceed.
It did not exceed.
It did not
Right.
exceed, it only showed, right.
They had a
It
detection
only
level.
showed that this stuff at this point in time was traveling in that direction.
And that
So
was
it
enough.
didn't exceed now, but how about next year?
Right.
And it prompted.
Understood.
it
This is
prompted-
just not presence, this is exceeding
Right.
the
So
limit.
that's worse than Charlton, so
And
we
if I
gotta
could-
get,
And if I can follow up with that also is, if we're seeing it at this point, exceeding levels at this point, and we've had that water line up there for several years now, what about stuff that has already passed these test points? Where is it now?
well, that is
How
where,
far does this field go?
that is where the private well testings will address on these occupancies.
Right.
Because we're not seeing any tests on the wells just south of the landfill.
Right.
We don't know where the aquifer is going because we couldn't get readings at the private wells of these homes that are right over here. So if we started this process by the people who can consent to going in and having their wells, the water tested at their home,
Right.
that will give an accurate reading of
How far?
pinpoints on the map
Where it is
of
now.
where and how much at all these
Now,
places.
yes. Yes.
And then that could be a caveat to say, how do we fix it?
Right.
And by fixing it with a water line will be a double fix.
Because we're putting a water line in either way, eventually, DP's gonna force it.
3 years.
This way, we may be able to get assistance.
Right.
It's a long time from now, though.
It is,
Yeah.
which, right, I don't wanna wait 3 years if I'm drinking contaminated water.
Well, no.
And truthfully, in Charlton, before the water line was in, Casella was forced to put point of entry filters in every home.
I remember that.
Or,
Yeah.
Portable water.
Portable water.
and that's a point I'm getting at by right now, if we get the consensus that this town goes forward with the recommendation of the Board of Health, then the town people with their lawyers and all this other stuff can start this process because we know what went on in Charlton. We don't wanna wait that long.
Right,
Right, exactly.
And then start this process.
right.
And in that way, we get DEP involved and everything else. I just don't want to do something where down the road, somebody says, well, you already started, you're on your own.
Very true.
Let's have the door open, let's get it going the right way, and we're gonna get all responsible parties at the table to, so let's make it happen.
Agreed.
And if it's gonna take, we can't do this till next season, then get the water into these houses, if it shows.
Do you think we should get Caprera involved?
That will be-
He is our lawyer, right?
But if I'm not mistaken by the rules and regulations, you have to go through the manager, right, to get lawyers involved?
Honestly, in this case,
Okay.
In this case, it would necessitate
Yeah.
speaking with the town manager on this
If-
particular issue.
if we were gonna do this,
Definitely.
honestly, if we were gonna get lawyers involved, I would think it would make more sense to go like through David McKay, who's the one who was dealing with the Charlton landfill issues in the first place.
You know what,
Because he knows the background.
this is a different avenue.
But that's have to deal with Jack. He's the one who would deal with that, and he's actually already involved in the Pleasant Hills Estates
But,
project.
you know,
anyway. He is-
let me add, if there's a complete agreement that it's certainly plausible hydrogeologically speaking, that this plume
Absolutely.
toxicity
Oh, totally,
is moving
absolutely.
in this direction,
Totally.
right? And you were right, Jared, where the only way to really ascertain how far it's gone through sample.
Exactly.
I mean, that's, everything else is just hypothetical.
Oh, absolutely.
Right,
Absolutely.
this is certainly a
Eye-opener.
start, yeah, with a lot of valid results that do showcase the concentration here.
Right.
And now it's just based on the movement.
How
How
about the
far?
lawyer thing of, like, if we're gonna send letters to these, should, have Rob look at the letter first we send, or just send it as far as that, notifying it, see if all these, whoever wants to get
I think-
involved with the testing.
I think right now, the first step, we'll get together with the manager, however you wanna do this.
Yeah.
We get together, we go together, well.
Yeah.
We have the templates already made
Right, right.
from the last thing to get permission. It would be just something that, to show whoever Jack wants, if it's Rob or whoever, hey, is this still legal? And send them out and get some feedback, But as long as we can start looking at getting some numbers on the cost, so that Jack will have a real grasp on how much per household. Because we're adding those 2 other chemicals, so the cost back then of that one product is gonna
Sure.
be different than today.
Sure.
Oh, sure.
And if you have that radius, which goes into your, when you said about roughly, theory, 20 people may be interested, or
Yeah,
could be affected?
20 or 25 lots could be.
Lots could be.
connected.
And that's only on Pleasant. I would wanna hit at least a mile down, because those houses are a mile, the houses are very far apart on Clements. But hitting some people on Clements, and that will give us a long distance by
Right.
hitting the first, let's say, even 3 houses on Clements Hill.
And if I may, there might be some value, just because this data clearly shows a plume moving, of reaching out. It might be the path of least resistance to get to the right person. Might be worth talking to Jim Philbrook to find out who at DEP in the cleanup section was the person involved with the Charlton side of these contamination issues.
That makes sense.
Because they probably aren't aware of any of this updated data or what we're seeing,
Right.
and they may.
Well, no, why would they care? Because
They're not gonna care until it's a problem.
Right.
and their problem's solved. And we may also have that upstairs somewhere.
I'm sure we do.
Does this name ring a bell? James McQuaid, Section Chief, Solid Waste Management Movement, DP?
I know,
Yeah, it does.
He's been around for a while.
I've heard the
right?
name, but luckily I don't deal with that department.
I don't know if he's still in that
That would be our
department.
I don't
contact.
know if he's still there.
He's a phone call
Because
away.
that was
There's a phone call.
Linda's-
Well, yeah.
Linda's contact.
So it might be worth letting them know that the data is changing.
Yep. Oh, yeah.
Yeah, the concerns are changing and the data proves it.
Mhm.
Okay, we can start on that avenue.
Do we need a motion to do that? or-
I would entertain a motion that the board is in full favor of beginning well monitoring testing on private occupancies on Pleasant and Clements Hill.
Motion.
Second. Shall we specify that up anywhere north of where the water lines now are?
That would be Pleasant Street.
There's nothing,
There's no wells that aren't
There's-
in the water system.
correct. Correct. If they're in the water system, they don't have wells.
There are no active wells that could be used for something else?
I'm only privy to drinking water wells, so I
Right.
couldn't tell you that answer.
And I do know there was some pushback when the line went through Charlton.
I remember that, yeah.
There was paperwork.
Right.
If you're gonna connect and we're not charging you, your well is to be capped.
I remember that.
And there was people that had a lot of pushback because they wanted to use their well for the gardens.
Right. Right.
You can't, it's unhealthy for you to drink, but you wanna water your food.
Which makes no sense.
So sometimes you gotta go slow. But
You gotta go
But that was one of the caveats, that you're gonna have one or the other, you're not having both.
I remember that, yeah. Well, I was thinking
So
about
we
that,
had
that
a-
may not be the case with current places that have wells in the public water system, because they don't have a restriction. They may
No,
have
they
something
do
where
not
they're
have a
using it for something
restriction.
else.
Because of the fact that there hasn't been any data or contamination in their
Exactly.
area.
Exactly.
Where some new lines went in, I think Walter Regip's old house still has a well. And he connected into, which is now buried. I think he has a well there still, but there has been no contamination in that area. This is a whole different animal.
Exactly. Exactly.
And the reason for putting a water line in is twofold, and the biggest concern is the health concern on what's coming up out of the ground.
Oh, of course.
So cap it, the end of it.
And truthfully, even the metals that they're showing here on this map, the manganese and the iron, while those are naturally occurring, then the concentrations we're seeing, they're not naturally occurring.
No.
The landfill's leaching heavy metals as well as dioxane and arsenic and probably PFAS.
And if I'm not mistaken,
Okay, so another-
the westerly side of the landfill was the first cell
It was.
that was built, and it was built unlined.
With clay.
Oh, absolutely.
It was a clay liner, not a solid,
That was,
Yeah.
that was the whole fight.
and that would be,
Back then.
I think it was this area. Yeah, it was this area, that was the beginning, going back way wood recycling.
Oh, yeah.
And that was a clay liner, so if anything was gonna leach out, it was gonna stop there.
Uh-huh.
And the people who took over and run it took over all the responsibility, so therefore, have a nice day. So we had did you have that
I
verbiage?
have a motion and a second.
You had the verbiage?
Motion to start testing on wells on Pleasant and Clements Hill.
We had a motion and a second. Any other discussion? Seeing none, all in favor? No opposed, unanimous.
Thank you for your support, everyone. Have a fantastic evening.
Yeah, thank you.
What time do I have to drop you off tomorrow? Thank you. Let me look.
Why are we gonna be here that late?
No,
It's no matter.
I have to drop her off for,
So random.
I have to drop her off, or she's gonna be for chemo at 10. I should be back if you want. I don't know if you're taking tomorrow off.
No, I'm here.
It's Friday.
Come on in.
And you can go upstairs and see Jack.
You have to dress it soon.
See about,
That's big.
I'll call Matt first thing in the morning before I leave. Dropping her off at UMass about 9:30, and then I'm coming home.
You're here till noon.
And I'll have Matt see about Jack putting aside, so we can put this proposal and see what he wants to do, which avenue.
Very good.
Perfect. Perfect. Okay, that's done. D, update trail cameras, cell phone updating as discussed and supported in the June 13, 2024 meeting, and take any action.
So yes, thank you, Chair. The Health Department did purchase 2 trail cameras. We were able to afford it. And we also need to get an updated phones. We got a couple. So we've been working diligently this week. And our inspector's really been heading it, Mr. Fuentes, of integrating these cameras with the phone. And he's successfully done that. So it can do both video and the still pictures. Okay. Pretty clearly too. The cameras run off battery and solar power, so it shouldn't be an issue. They also, I mean, that could be a live feed to cell phone, but they also operate on USB. The USB cards, not that
US,
what's the card?
SIM card.
SIM card.
SIM cards.
I
Yeah,
mean,
thank you.
Yes.
And
Yes.
SD
so that's what it is. And you can take that out, and we've also purchased an adapter to the computers that you put these cards in and can read out.
Yeah.
So we all know the trail cameras, motion. We have 2. Now it's just picking a location. Locations.
Yeah, because the intent, which we had discussed before, is to put them in the high priorities, and when they
Yeah.
get slowed down, move them.
Yeah.
You know, when he tore these apart and looked at them, were they able to go to an app on a computer? Because they're wireless?
That's the app that was placed on his phone. That's a good question. I don't know that. And again, it clearly we did a trial run and the picture showed up on the phone. And then you could do that video.
I know the video with people that have trail cams in their yard, the video takes more juice.
Or just,
What
yeah,
they
so-
did say for our thing, you could also change color to black and white. And they said color would be better for what we want to catch. Was that a blue
Color
pickup?
is- Yes, yes.
Or a black
yes,
pickup?
Yes.
That
Yes.
type of deal with a color of the plate.
And it has the capacity to focus in and with the
Yeah,
pictures,
we use it
you know,
in and
ease
out,
out.
yeah,
So
yeah.
it's got some nice features. They weren't overly expensive.
Good.
We were able to find the money in the budget, and pay for it. This could be just a trial run, and if they do work, purchase more.
I'm just wondering
in
if-
theory, but now it comes down to placement and actually using these, really in the field and seeing them come up, you know, with the results.
It's like
I
the
was,
ring thing.
I was just wondering if, because everybody uses the app on the phone because
Yeah,
of that
I have-
reasoning,
yeah.
but I'm wondering if there's an app that you can get. I know you can get different apps in
You
the
can,
computer.
like for my office, I have Blink and Ring.
But I'm wondering if you can install that app on the
Yep, you
computer.
can, yep, I
Which,
can shoot it on my cell phone
If
and
you
my laptop.
don't need to update the phones, then whose ever computer these would go to, like if it went to Rick's computer and if you want if you install them in all your computers, you could look at that app at any time and, yeah, okay, get rid of the pictures of the deer unless you want to put that as your picture on your computer.
I can't answer that. That's
I don't know
more
if he-
technical than I know what he did, and but he was successful in the operations at this point. We had to get updated phones anyhow.
Yeah.
Several were just antiquated.
I
So,
can tell you that we had to.
And that's
update
why
our
it
phones.
was one of the discussion that we had. You know, when you're off on the weekend, we don't want that to go into somebody's phone and bugging you.
Right.
But if there was an updated phone sitting on, let's say, Rich's desk
We can take.
for the trash, she comes in and checks it on Monday.
Yeah.
If she's on vacation, somebody else is delegated, check it out, and then it just gets set to the file.
Yeah, right.
Plugged in and put on a file to go after somebody.
I know some of the phones that we had looked at initially, the higher end ones, I think had all the bells and whistles.
Of course.
But probably double the price and more features. So right now, we have the units. If you guys would like to come into the office and check them out before we install them, set them up, you know. And then again, we don't want to reveal to the public where we put them. That's it's gonna be incognito right now.
We have
We
to
post
find
it.
placements. Some of these places, there's not a lot of hiding places where you could get a good visual.
Right.
And then people say, what if people steal the cameras? Their pictures have already been downloaded, so
They
now
have,
you're not
you're right,
illegal
you're right.
dumping, but you are now damaging and stealing town property.
Yes,
So we'll see you in court.
that's right.
Cops will come pay you a visit when you're going to jail.
Because I know we just had another one, where was it? I think there was the concern, a major dump. And we've been lucky that it's been slowing down, these normal sites, but I think it was H-Foot Road that they were trying to decipher if it was Charlton or Southbridge. And my point is that somebody was being a pig, and the only reason of which town is who are we gonna ask to pick it up?
Of course.
That's about the only thing.
Yeah.
But
You're
if
right.
there's dump sites, there's dump site, and these little cheap in the big scheme of things to curb that,
I think they'll be quite successful.
we have the
We
signs.
have the signs. They have been working, I can tell you.
That's good.
And
But people have still dumped because they're getting brazen
that they.
that I don't see a camera. And they're still dumping right under the sign.
Right.
So get the word out that there's a sign, and then all of a sudden, however, you know, like we did with the blight to embarrass people.
Yeah.
Anybody know this person? Tell them to come see us and pick up their stuff before it goes, the paperwork gets to Dudley. And then the word will get out like wildfire,
Yeah.
because they won't know where the cameras are.
Right.
And that's
Yeah.
why we discuss the trail cams, because inexpensive in the long run and movable.
And that's good. I know a couple of days ago, we found a bag at the very end of Gulfwood. And we ended up just throwing it out, getting rid of it, but that's where it was.
Did you go see if some idiot left addressed envelopes? Because they caught one
I didn't feel
like,
like digging through it.
they caught one like that already up by the
It was
airport.
I've heard,
And
yes.
it was a Southbridge resident.
And that airport area, when I first came to town and started working, was
A mess.
torn. It was a mess.
It's hard-
It
it's
was
been
a
a
mess.
lot.
Correct.
It's been nice.
Yes, it has. I was just talking to Steve about that. So
Yes, it's
much,
been
much
very-
less, but there was very active there. But you're right, there's still pockets in this town which
And it
have
fluctuates.
historically been notorious for the dumping.
And it fluctuates. You know, they'll have and the trash monitors have been doing a good job in watching
They have.
these known areas, and a lot of these places have been cleaned for a long time. And this place on Barefoot, this isn't a bag, this is like a truckload of bags.
Yeah.
Yeah.
And it's disgusting. So,
So we'll
right.
give you a report next
Keep
month.
us-
'Cause we're gonna
Okay.
install them.
keep us surprised,
I
please.
had garlic for dinner.
Too much information.
Yeah. it does.
Okay, E, blight update.
Okay, Blake. I can share some good news that 20 Brick Row, the dwelling has been demolished. down. It's in its final stage where graded mulch of that. So the majority of the material there has been taken out. Okay? So that resulted in a.
And we don't own that, right?
We do not.
Okay.
No, not.
So that's still somebody else's.
That is true.
maintenance.
Do we have any update on the Hamilton Mill issue?
The
On the Hamilton Mill issue?
Hamilton, the mill?
Yeah.
No.
No?
Nothing as of yet. I think to remove all the items there, going through a brownstone.
Yes.
Right?
I was gonna say, that went.
That's gonna be quite an expensive endeavor,
Yeah.
move all of that debris.
How about the engineering study looking at whether it's salvageable or not? Did that ever go
I
in?
have not heard it. I think the more focus is getting that debris out right now.
Yeah, and I know that went through the council
Quite a
3
while
meetings
ago.
ago,
Quite a while ago.
at least 3 meetings ago, and they got a brownfield grant.
Yep.
Yes.
But again, advertise, go out to bid.
All of
All
that
that
has
stuff.
to take place. But again, the fencing went down there just last week, secure. There wasn't any evidence of people getting inside of the fence area.
That's good.
So things, the building is secure,
Okay, that's good.
which is we can, and I have not heard of any trespassing or any other kind of activities that would warrant some attention. So that's where we are there. But moving forward, 253 Morris Street, with the assistance of Attorney Capero, did petition the court to enforce the state sanitary code and have filed the complaint. The issue being right now is the legal service to out-of-state defendants. They are from Texas, Sugar Land, Texas.
Is that the bank or the owners?
The owners.
Oh, really?
Yes. Individual.
You know-
Individuals with the same last name.
That's what was really funny on, started this whole blight with the Hamilton Street property, where the owners moved to Florida. And then it was publicized through the town and the townspeople and things like that. And then all of a sudden it got on, not from us, not from the town, but it got on the social media site of the church that they go to in Florida. And they were not answering anything that the town sent, and next thing you know, there was a lot of communication.
Well, that's good.
You waived the backwater sewer fees, we'll deed the property to you. Thank you very much.
Well, Mr. Capero is going to be giving me an update. I know I missed him. He came into the office. He was obviously at court, but he did emphasize that the court system is adamant that service is done properly and legally.
No, it has to.
Yeah,
Oh,
and
yeah.
so, so it could be a bit of a waiting time.
Okay,
We'll
so-
keep you abreast of the results of that one. Now, moving on, 19 Crestwood Drive, the Attorney General's office will petition the court for appointment of a receiver unless the violations of the state sanitary code are abated. And they have 14 days to see after the letter, and that letter was dated 31st. So, Janice I've been working with Janice Fahey. She's the Assistant Attorney General there, the Housing Division, and just communicated with her this week. She'll keep me posted. So there is obviously some positive movement right there. Then other properties will follow suit.
How about the Hamilton Street?
The
blue
is it
one.
215, the 215 Hamilton Street, what I've been told by the building department is there is still an active building permit
Oh, there is.
till the 19th of August, which they have that time frame to
Yes.
enact any type of measures and start the building. My discussion with the building inspector, I haven't followed up, and he was concerned that behind the dwelling was a garage that has been taken down. Has fallen down, but presumed taken down without the necessary permits. Just something to keep, and again, 19th. They have not demonstrated any activity as of yet, but they do have that until 19th.
They paid for the
Yep.
permit, so we have to,
So,
okay.
but that will be added to the list, and hopefully we can get some results for that property.
That's good.
Um, Unless they do change their tune and just start the work.
Right.
Then it's a
They
different
have that
process.
right.
Where do things stand as far as that Dennison Cross Road house we visited quite a while ago?
That's the one we'd like to move with, again, petitioning the court for receivership, one at a time though.
Okay.
But
That's
that
the
one
next
has
one with
still
the Attorney
been
General.
maintained,
It-
secured for the most part.
It has, yeah, there's some degradation of it, from the roof to the decking.
Okay.
It's showing signs of weathering. I
Right.
mean, nothing major, and I was out there with Mike Julian, the building inspector. It's just a cumulative effect from the siding, windows, and things like that are just, again, deteriorating. But the roof has had a tarp on it for a while.
We have a few houses like that.
Yeah.
Right.
But that one will be next to
No,
address
Robin,
with the
listen.
receivership. But I know, what I do know, it's managed by the same company that really winterizes these homes and does some maintenance. And I don't know if the USDA is involved, like with Crestwood Drive. So,
At the new in Vienna? At the new at the Vienna building?
Oh, that was the other one.
There was somebody there the other day.
I did see
we
that too.
saw some people there, yeah. It's at a standstill. We presume that, and,
I didn't see them working, I just saw people
right.
in the parking lot.
Yeah,
Oh,
we
when
don't,
I-
we
they
don't
were-
know if they belong there or
They
not.
were in the driveway, but they were like looking at the front of the building.
That's what I mean, they were in the
Yeah.
parking lot right there. in the
Hopefully
front
he's
of the
gonna
driveway.
sell it, because I heard that there was a prospective buyer and turn it back into housing
The
units.
house.
I as well.
And
So
that's
perhaps
what it
why
was
they were there
before
on
you,
site looking
yeah.
around. People, right.
And it might be a concern to be proactive. And you kind of put the hair on my neck go up when you said winterizing it. We have the social hardships in this town about homeless people. And when we have these vacant apartments and these vacant buildings like that the landlords are reluctant to keep an eye on of access, and we have the squatters going in and living in non-livable conditions to get out of the weather. It's gonna be winter before we know it.
Well, unfortunately, and like also share lastly, the 50 Clark Street, which is a property that we've identified where there's activity. We were just on site today.
Oh, that's another one.
There was an order issued, the owners, for securing the property and just cleaning the outside. You know,
That's
a lot of
vacant.
rubbish and trash, but the front door was replaced by the owners and this management company, but the back door wide open with trash, evidence of trash, fairly new trash activity inside. The house has not deteriorated badly, but the concern is it's open for vagrants,
That's, yeah.
any all other activities. Wide
That's,
open.
that's gonna be a growing issue when the cold weather starts.
Yep.
So I hope we come with a better plan for those who are living on house. And as the rents keep going up, that's gonna be even a bigger and bigger problem.
Yes.
Well, I wanna say, I don't know if you remember, but I'll have to watch it. There is going to be
Yes, subcommittee.
there is a subcommittee where these two groups that were buying buildings in two sections of town.
One of them already did.
Well,
They
they're
run
supposed to
6
give
properties
a
up
presentation
with
on what
1.3
they're,
million. Was
They
it?
just bought up Mechanic
Yeah.
Street last
Yeah.
week, they just bought up a whole bunch more on Mechanic Street from the old Lucy's Laundry.
Yes.
Almost to the
Oh, is that
corner.
right? Yeah.
and they're
Towards
supposed
Henry
to,
Street?
Who?
All the big multifamily.
Good.
John Field. They bought
And
all
only
of
Ave.
them. Comet, the one Comet's, they bought them all.
And they're supposed to give a presentation on what they want to be doing with it.
Yeah.
And one of the questions is that I've been bringing up to people's ears is that having a plan B on what they promise and then what they come through with. The Wells building was promised to be affordable over, senior housing.
Exactly.
And then when they couldn't fill it to pay their mortgage, they opened it up to everything. But, all right, good. Anything else on the blight?
No.
All right, F, I know we beat the heck and you stole you stole the show today. If you have anything else?
I think the another announcement I have is for the public to just be cognizant that West Nile virus and Triple D are not necessarily in this geographic area, but has been found in Worcester and parts east,
Yep.
and will have traveled this way. So just still take precautionary measures at this point. Okay?
Thank you.
Perfect. Okay. 9, solid waste, town agent for solid waste and recycling materials report. You got anything? Put your glasses on.
I do. Just a couple of issues, updates, I should say. The curbside, we've added non-conforming toter letters because the town issued, as you know, the solid waste regulations state, the town has issued one toter with the town seal and serial numbers to each household, with 6 or less units. Casella has notified me that a lot of the properties are now placing non-conforming toters. So this is a sample letter that's been sent to these addresses with a blurb of the regulation and a photo that Casella is providing me. So they are not to put any additional bags and or non-conforming toters out on the curb for pickup. So that's another item that we.
Casella not picking them up.
They're not
also.
picking them up, right? They are leaving them at the curb. We are battling bulk pickup out on the sidewalk and on the property, and they are complying
That's good.
for the most part. They are. I have a handful of property owners that are difficult to get a hold of, but we're working on it. In addition to, we are preparing a letter for the commercial properties over 6 units regarding the mandatory recycling.
She says
and that's
commercial. These are the residential units that above 6 family
6
that
units.
don't have curbside.
Right.
Your Rosemeads,
That's
your
not qualified for
Southbridge.
the curbside collection.
She calls them commercial.
I do because then,
Yeah.
okay, household hazardous waste day training. Because this is the first year that Casella is not holding the household hazardous waste day event, the town is. Casella has agreed to do some training for me on the 16th, which is next Friday. So we can be in preparation of the hazardous waste day. That's gonna take place October 5th from 9 to 1 over at the DPW. We will begin to advertise it hopefully anywhere between 45 and 30 days for this event, because I believe it is going to be one of the biggest ones that we've had.
Are they going to be
In attendance, yes.
playing a part,
Mm-hmm.
but the overall responsibility now is managing as a town?
That is
Okay,
correct.
yeah.
Yep. And I think that's it. Oh, we had Callie, who just transferred over from part-time curbside to full-time in the collector's office. We've recently replaced her with John Calcagney. He's working 15 hours a week. He's working out great so far. So we replaced her in no time, which is great.
Rich, how are we doing with the opt-in, opt-out? Have you seen any?
That's a good question. So initially, the opt-out program was crazy busy. This time around, we've had only, so far, 72 property owners opt out. That's 145 units, which comes out to be 16,000. So, with that being said, we have 3 more weeks for them to opt out. So it could be more, it could be
Yeah, anybody coming back?
reasonably. No.
So
We
roughly
have
where-
not had anyone come back.
So roughly where do we stand as far as,
We're not
Jack's
even hit-
estimate of
Right,
what our
we're-
10% was?
Right, we're not even hitting the
We're
10%.
not at,
No,
that's good, that's
no,
good.
it is good.
right.
But we do still have 3 weeks.
Right, good.
From what I have heard, there has been several people who have brought up the question of how can I opt back in? They brought it up to the town manager's office, some other offices, and they were told, we will gladly welcome you back.
Yeah.
But look at your contract that you've signed with the hauler because you're gonna be paying twice. So
Right.
make sure that you can get out of that signed contract,
Exactly.
and that's the business model. You signed the contract, it has to be honored
Yeah.
unless it has an early out clause.
Right, right.
We've had a lot of illegal dumping over at the airport, H-Foot Road, between the Southbridge and Charlton Town Line. And we're still waiting on the cameras, and I missed that agenda item, so
Yeah, you
we're
were having
looking
your
at that.
attack. He's got the cameras, they've been playing with the cameras.
Okay.
And he's looking to update the phones
Okay,
and welcome anybody to go to the office to look at how it works. I guess
Perfect.
Daniel's got the app on his phone. But like I commented, we didn't want the app, I don't want the app on somebody's personal phone.
No, I agree.
You know what I mean? So he's
Right.
looking at updating, and he's got some ideas on the different phones.
okay.
And Daniel's been, young Daniel's been looking, no.
No offense.
You're closer, you're closer to retirement than he is. He's been playing with them, so what I did brought up with the paperwork and stuff, to see if there's an app that can be put right on a computer. So it talks to the computer, or does it only talk to the phone? I don't really know.
Okay,
But he has 2 cameras,
nice.
and then we'll work on that. I want to say for the public, she might be small, but she is holding the contractor at bay for violations of the contract. The trash monitors are not only looking for violations of trash and to make sure people comply, they are also watching that the contractor complies. And there's been documented evidence, and there's communication going back and forth, and there has already been financial amendments done. I think that's,
In a nutshell.
as they say, that's all I could say about that.
Perfect.
So she's up on top of it. Nobody's gonna get away with anything with that one. Is that it?
That's it, right?
Okay, is that enough? Okay, almost done. All right, review and sign all documents for solid waste disposal commitment. I am gonna leave the agenda as is, and I'm gonna have this number 10, this item on here. And what I will do, because Michelle comes up with the numbers at the 11th hour, so what I did is I sent out the separate document to everybody.
Right.
And I will do this as supporting documentation. If this goes away, it goes away. But the verbiage, when Michelle gives it to us, instead of doing an amendment agenda and then having it posted and all that other good stuff. So we have this documentation, but this refers to in number 10. So let me read it. There are 2 of them. Vote to accept and sign the FY 2025 first quarter trash bill enterprise commitment in the amount of $644,920.
Second.
We have a motion and a second. Any questions? Seeing none, all in favor? Unanimous. Second one, vote to accept and sign the trash bill adjustment commitment in the amount of a negative $12,880.
Motion.
Second.
Motion by Mr. Splain, second by the 2 gentlemen on my left.
Gave it to her.
Okay, whoever. Any discussion? Seeing none, all in favor? All opposed, seeing none, unanimous. Thank you. All right, we'll start with Chair and Members Foreman.
I'd
Go
like to
ahead.
say thank you to Dan and Maritza for all your information tonight. Thank you very much.
That's it?
That's it.
God,
He talked.
I hear him talk more when he's mowing his lawn.
That's, I'm saying.
Oh, is that what it is?
Yeah.
Gus?
I don't have anything at the moment. I think I pretty much said everything I needed to say, so.
What? Okay. Jasmine, my dear, do you have anything?
Yeah, I think the only thing is, I know that there was some talk on the board upstairs about starting subcommittees for individuals who are living without a home. I really hope that that really, comes through as somebody that works with that population, and I hope that we're really able to make some crucial changes and impacts to, a community that, it's such a hardworking community, but we're struggling, and I'm talking about the working class, just as much. And I'm seeing a big influx in, people that are getting recommended for our services, both on a mental health side and on an economical side, and it's really worrisome, and I hope that instead of looking more for punishments, that we can look more for resolutions.
Right.
Because that's really in the direction that we're gonna make the biggest impact, is not by criminalizing, individuals. That's not gonna get anybody anywhere.
Absolutely.
For me, I hope that, we can make these changes as a town appropriately, because I'll speak for myself, I never know when I'm gonna be in that position, and hopefully, there's programs and different opportunities out there to be able to create, a little bit of relief, so.
Right, good.
Mr. Vice Chair.
I have a few things.
Oh,
First, I just want to say how disappointed I am with the town council vote last week.
Oh, yeah.
And not
yeah,
supporting
sure.
us on the IMA.
Yep.
I thought that would have been a big tool for us
Mhm. Agreed.
going forward. I was very disappointed on that. The other thing I would like to talk about is, what's the status? On our meeting on the 11th, we ended up under the Tobacco Alliance, one of the hearings, we found that Quick Corner responsible. Have they paid, or how does that work now? Because that's the first one in a year and a half that I've been on this board that we found responsible. How does that work? If they pay, if they don't pay? What happens if they don't pay? Do they have a certain time frame to pay?
They pay, don't they pay directly to the,
They would pay to us, that goes into the general fund.
right, yeah.
But
So
my
they
thing
have
is,
not,
somebody
they have
going to
not,
follow up?
the gentleman missed the meeting. He was out of town. Now, the issue being is, when he had come in and submitted his letter, I was there personally with Patty and gave him the date on which the meeting was going to take place, directly. He feels he should have got a call that morning, et cetera, et cetera.
I
He
didn't
is
call
not-
either of the other two.
We did in the same manner, and as they.
We're not gonna babysit.
Yeah. So, he's not paid. Will he pay? Hopefully, but if he doesn't, consequently, he can lose his tobacco license. from the board. He could be suspended or revoked.
Do we know if there's with this alliance, and I've complained about it since day one, their timeframes, I don't agree with how they do it. They can
Yeah,
take 9 weeks to send you a complaint, but you have 5 days to respond.
Right.
How is it with the fine? Is that
Doesn't
set
this-
upon them, or,
that's not
you
fair.
know what I mean? I don't agree with that, and that was one of my biggest problems
Right.
that I have with them.
Right.
But now, we're the bad people, because they set the fine, we gotta go after it now, so we look bad.
Right.
What are the consequences if he doesn't pay it? Are there any? What happens? So we're the bad guys, we shut him down, we take it, his tobacco license? That's where, like I said, this is the first one in a year and a half on this committee that we
Doesn't this
found.
follow, because this tobacco place works for us. Doesn't it follow like you failed to pay any other town bill?
Yeah, it probably does.
It
yeah.
will support.
Any other town fine, I should
Fine.
say.
They do reach out to us in order to get clarification if a fine has been paid, or an attempt, even at that.
They can go on a pay schedule.
but
But I just don't
but-
want it to go by the wayside and all of a sudden.
they're
Yeah.
mostly
6 months
for
later.
that support mechanism where they would go in front of the board, folks, and assist the health department addressing the board whether the permit should be suspended again or revoked, which is a decision on the board for how many days, so on, so on. Right? That's their job and that would be their prerogative. But we do get mostly people that pay because, again,
They don't have
to
to lose their
address
licenses,
Exactly,
yeah.
of course.
that consequence can take place. There's, you know, that cost, there's no penalties, interest accrues.
That's what I mean, there's no.
He has
Wait,
reached
no,
out
wait.
twice too. I've spoken to him twice, and he said that he was gonna come in and talk
Which
to
is good,
Daniel,
which
and I
is
haven't
good,
seen him.
but
Yeah, I was waiting a day for a conversation to have that with him, but he did not show. So we're at that point where we'll issue a letter emphasizing again, here are the consequences of your action if there's no non-payment made.
Yeah, we didn't know if that goes through your office or
Yeah, I didn't
finance
know
director.
that's. I didn't
Like
know
a
how that
21
went, 'cause
day.
I know you're collecting some in
So
the office.
it's supposed to go through the clerk's office, but we have taken that over so that I can keep the records up to date.
Okay, so we need to
Okay.
know that, but it will be, it's with the clerks for that.
They didn't realize that they should be telling us so that we could update the record. So I'm just gonna do it now.
Another thing, Dan, is it possible, in the past, you had a list, like a master list of the blighted properties we were looking at. Can we get an update, updated? No,
Hey, Mike.
20 Brick Road comes off the list. I'm not sure if it's 65 or 56 Main Street or something. That one on Main Street, I don't know. how-
Yeah, I can
Can we get
update it because
somewhat of
the
an
things are
update?
moving,
They're moving a lot. So if we can.
that they are.
if that's possible, I mean,
I'll get a list
they're
to
moving
you
quite a bit. I mean,
of,
which is good.
of our properties.
Because we've added a couple to 253 Moore Street, but there's a couple that have came off, come off.
And some are still on there,
Yeah,
as I indicated. Those have been present on the list for a while, but there are steps and actions that are taking place. Just as not as quickly as we'd all like, you know, but they are being taken. I can assure you that. But I can get you a list.
okay. Two more things, Mr. Chair, if I may. I brought this up a few meetings ago about unregistered vehicles. I know the town has a bylaw regulation. I think that the Board of Health should be able to step in now, and Dan added in also, and I like what he said. I mean, it's 2 vehicles per property according to the town, but if you have a vehicle and you got trees growing out of it, it's been sitting there forever. I think we as a board should be able to go after that as being blight,
Oh, yeah.
but the problem is the town regulation or bylaw says you can have 2. So I think that's something,
If you look at the town bylaw, because I think if it was something in the town bylaw, it's a motor vehicle. If you have trees and it's not roadworthy,
That's a planter.
it is now parts. It's not a vehicle.
It's the
So
forum,
technically, you have a
Landscaping.
yeah.
Kerboy's junkyard
yeah,
Oh, yeah.
when you got a tree growing through it.
Yeah, and that shouldn't
That's just-
supersede public health and
that's just
safety.
something I think we should start as far as on the board side being blight.
Yeah.
We have gone after vehicles. I have found them. Again, these inoperable ones,
Something.
Oh, yeah.
sunk into the ground,
It's the
trees growing
forum.
flower. It's
They did
yeah.
one in my
Straight
neighborhood years ago.
Yes,
There
yes.
was a truck.
Not only that, but other types of vehicles, from boats,
Put the toilets up.
cycles, you know, things like that. We do find
It's
here and there.
abstract art, I'm telling you.
Art?
Would it be,
Okay.
would it be
It's great in Toronto,
inconvenient,
they actually make it art,
since we have 3 people,
but they're actually taking care of it
Removing-
too, so.
the neighborhoods, to perhaps keep an eye out and take a picture of something that they see like that?
We can do that.
To put that in their radar as well. I know they got a lot in their radar.
I bring it up because I've gotten quite a few phone calls in regards to that from people saying that's like seeing it as being neighbors or in a neighborhood, looking at it day I don't blame them.
Can you give me addresses?
Yep.
Yeah.
And the
Go
last thing,
walking
I-
around with the camera.
the last thing I want to bring up, Mr. Chair, maybe for our next meeting, a few people have reached out to me in regards to the Board of Health numerous years ago, put a ban on plastic bags. And
We have one, don't we?
Yeah, it's dumb.
exactly, I would like to know if
Okay.
we can discuss and possibly vote on reversing that ban. My personal reason is it's not something that is consistent throughout Southbridge. The supermarkets still use them in delis. I just think we should give all of our businesses the opportunity. If they want to use them, use them. If not, don't. I don't know of any other town that.
There's a bunch of other towns that have that.
Connecticut has banned them all together. You gotta carry.
So I just wanted to see if we can put it on, and I wanted to give everybody a heads up now if they wanted to do research or whatever.
Because I know, correct me if I'm wrong, way back when we put this ban in, it was, no. It wasn't the thing of recyclable. It was the hazard of tanglers and the stuff being in trees. And these were the plastic bags
Yeah.
that had handles.
They're all over the place.
It did not impact that when you go to Big Y and buy chicken and they put it
In the
in the
plastic.
plastic
Yeah.
bag. It didn't impact that.
Yeah,
You go to the pharmacy
yeah,
and they give you a plastic bag, it has no handles.
yeah,
It was, the problem with the plastic bag were the bags with the handles.
yeah.
That was getting into the environment, that was killing the fish, that was getting around, there was the
Like the
tanglers.
soda thing, the.
It was like the
Yeah,
soda
yeah, yeah,
Like
tray.
one
yeah.
across the street and they're.
And that also got a lot of
You gotta cut 'em.
recycling people,
Yeah.
that got a lot of recycling people injured and severely injured to dead when people thought that went into a recycling stream. And then at the separation plants, it was a tangler and there was people that got brought right into it.
Yeah.
We had one up here
Yeah.
that got caught in the process.
Yeah.
They still use them at the convenience stores and the liquor stores.
Yes.
With
That's
handles?
what I'm saying.
Yeah.
It's inconsistent in this town.
Well, they're
Yes.
not
Maybe we
supposed
need to
to.
make it consistent and get rid of them all.
You can't take them out of the supermarket. Say, you're still using a plastic bag. I don't care if it's got a handle on it or not. Plastic is plastic.
We bring
Well,
bags out to market all
we
the time.
did get those out of the supermarkets. The liquor stores are violating the rules.
That's true. Exactly.
That's what they're doing.
Yep.
I haven't frequented one, I'm just saying.
You haven't seen the black bags?
She doesn't use bags, she takes the whole case.
That's it, Mr. Chair. Thank you.
Okay. I was gonna say, Dan, who, or is it you, that's our licensed lead determinator for the
I
town?
am.
You are?
Yep.
Okay. Somebody asked me if we have a lead determinator.
We do,
so-
and we want to get Mr. Fuentes the program. It's just been cumbersome in
Okay.
order to get that licensure for
Well,
us. We're
that's-
not inspectors, determinators.
Determinators,
Yeah.
correct,
Yeah,
He's the
correct, there's a difference.
there's a difference. That's right.
And this was somebody who, the kids had an issue.
Yep.
Now you need somebody to determine if.
Yeah, if they make a call.
There's
yeah,
lead in the
there's
house.
children, yeah, supposedly we can do that.
Okay, perfect. We have that in town, that's good.
Roland, there was one more thing.
Of course.
We brought it up, I brought it up before. Have we done, and I know it's a touchy situation legality-wise, but dogs in the supermarkets, in a coffee shop. I was in Big Bunny, and there was two dogs. I thought they were gonna stop fighting.
Actually, I saw that too.
You,
Yep, I did see that.
and these are not, in my opinion, and I'm not knocking anybody, I mean, service dogs usually don't bark and go after each other.
They shouldn't do it.
Exactly.
No,
So-
It's
And I know it's a very
sensitive
sensitive thing,
Oh my
but
God.
I don't know.
I think sensitive
When
is
this was
mild.
brought forth, not last meeting, the
meeting
day
before.
before, we did make visits. I personally made visits to the locations.
Yep.
And from the management team down, they do all acknowledge that this.
It is touchy, I know. I don't know if we can
that
put signs.
this
or-
is challenging, but the fact, ADA regs, and requirements, really do not allow certain things. So in certain things, I mean, if the individual person in charge of a food service establishment has limited questions that can be asked
Right.
pertaining to this animal. And as we discussed, the expansion of what defines a service animal. is pretty low. And, yeah, people, not only dogs, ferrets, cats, and they may constitute that. So, if it falls in definition, that's the challenge. So certainly, some of these locations which are owned by corporations, okay, do understand that as well. It's just very hard for them to curb that.
And they
Now-
can by organization, well, per company to decide within their own bylaws whether they accept those kind of animals.
It can,
or
to the,
not
again,
to.
at the front of the
Yeah.
house, the dining areas, certainly if there was anything in the kitchen, the food operational
For
areas,
administration,
that
yeah,
is not allowed.
preparation, yeah.
Correct.
Regardless. We have not heard of that or had any complaints,
Yeah,
but certainly people coming in and even leaving their dogs
yeah.
on the dining table
Yeah.
while going to the restroom, things like that, and they're left unattended, et cetera, et
A lot of
cetera.
which shit happens.
Yeah, so,
That's technical. That is boy, I don't even know how you.
to
would
mitigate the
I just wanted to bring it
activity.
back up. I mean,
Yep.
there was that incident, and a lot of people made comments when I was in Big Bunnies, and I was at least 7 aisles over, and I could hear those dogs going at it.
And you know what? That's something that I think for this board and the office, that's a very slippery slope. Because you're infringing on, I'm telling you, that's my
Emotional
emotional support vehicle. And it helps me with my family issues or whatever.
Anxiety, yeah, social anxiety.
If people feel unsafe in these places because of that, they should be bringing that up to the management. Because I don't
figured
think
I'd bring
that's
it up.
enforceable. We can make rules, but if it's not enforceable.
No,
it's
not when
a
Kevin,
waste-
like,
Oh,
like,
for
eating,
some
I'm not
people.
trying to eat, and all of a sudden there's like a pit bull right next to me.
Well, it is enforceable if we
Yeah.
see even a service animal, in, again, the back of the house.
That scared me.
Correct.
Okay.
You might be allergic to a dog, but if that's a licensed service animal, they'll find you another place to
Oh, are you
sit.
kidding me? I run through it. I can't deny
Correct.
and no matter what my feelings are about it, you'll get sued immediately. Yeah.
Yes.
And it's a big
So-
lawsuit too.
Yes,
Yeah,
yes,
It's
if you're
nasty.
infringing
The
that.
Disability Act for,
PR.
like, it's not gonna play around with it, yeah.
No.
I'm bringing my dogs to work on Monday.
Okay,
No, you're not.
is that it? You didn't forget anything down? Just- Okay, good meeting. One of the things that I wanted to bring up to you, I know the town manager talked about a manager's homeless committee. You know, like you got the town manager opioid.
Yep.
Yeah, like we have a
Um,
substance committee meeting.
Correct. He talked about something like that, and of course he started, but I think something in the forefront because of the mental health issue and the other type of issues going on, you know, and you hear this on the news and you see it in these other communities. Tearing down tents does not solve the problem.
Nope, it sure doesn't.
And we still have the opioid problem, and that's not gonna go away soon. Taking care of that is way above us. But we have to deal with our locals, and that's what I was talking about. Winter's coming. We have a lot of people, and there was a counselor that brought it up at the council meeting Monday night.
Yep.
I don't know if anybody saw it.
Very much so.
Questioning about a bylaw possibly to stop these people from sleeping on park benches. The look at some of these other councilors brought, and I'm shocked that social media didn't blow up. Having a bylaw that is like the worst thing in the world for me.
Yeah.
That's a
Criminalizing
lousy
businesses.
excuse
Yeah.
on solving the problem.
Can you believe criminalizing people for their inability to not have proper finance? I mean, I find that just really.
We're giving money away right and left in this community, and it's
Yep.
society, I want to say society. And we're giving it to the wrong places. When we have servicemen
Yeah.
and ladies,
Veterans
that come back injured and they're homeless
Yeah.
because of the mental illness from what they've seen and experienced, and they're living on the street, that's deplorable, that's shameful.
Right.
And making a bylaw and even bringing that up, to me, was deplorable. That has to be answered at a different level.
Hopefully, they're never in the situation where where they need somebody to help them.
And that's why I brought up, not to the point of that, but I brought up like the house is not secure.
Yeah.
Yeah,
Because if people go in the houses, look at what's happening in California.
yeah,
If you pitch a tent on somebody's front lawn, that's now your abode,
yeah.
okay? And the whole problem is, if it's my thing is, if it's unsafe for them to be there, especially in the cold weather, we need to find an alternative and help them to an alternative.
Exactly. Of course.
I sent an email
Okay.
to the council after that, specifically advocating that we need to do a lot more public housing in this town. And I think that the town, if we could take the towns, when the town takes viable properties, instead of turning around and selling them back on the market, turn them into decent quality, low-cost rental facilities for people who need housing.
That's a
As
nice,
opposed to the ridiculous $1,700 a month.
That's a
thing we
nice
have
wish.
Now.
that's a nice wish,
It's a start and a step in the right direction.
but that's my concern about the people that brought up all these other properties, because we've been hearing a lot of rumors.
Yep.
And we were sold a bill of goods at the affordable senior housing on the corner of Marcy and Main.
That's why I'm saying we make it publicly
And
owned,
now-
so the town owns it.
Now it's all about, I'm getting rent money.
No,
Okay.
that's what I'm saying, what the town
And,
needs to do, so we are in control of it.
We need to help these people out to be self-sufficient,
That's a start, yes.
because a lot of these people do not want freebies. They don't want the giveaways. They want to be self-sufficient. And they'd rather sleep on a park bench before I take gratuities.
That's why I'm
And
saying,
we
that's
need
why.
to educate them and educate the public
Requirements.
and give these people help to get on their own 2 feet. You know, you see it all the time, and it's, you know, you can say it, you know, all you want, but there's a lot more than this community can do.
Oh, I agree totally.
So,
Criminalizing.
but that's all I
is
got
not the way
before I
to do it.
lose my mind on that. Good meeting. Number 12, discussion in that next meeting date, Thursday, September 12th, 2024, 6 PM.
Motion adjourned.
Second.
All those in favor?
I guess you wanna say-
We're adjourned.